Hi everyone, this is Dr. Linda. Happy Monday. For those of you who don't know me, I am Dr. Linda Marquez-Gadine, functional medicine practitioner. I'm a chiropractic physician, and today what I wanted to talk about is your thyroid and the possible connection to cholesterol. Most of the time, I've been testing patients for over a decade with running labs, checking their panels. And you know what the first question always is? How are my cholesterol levels? And there's such an emphasis on our cholesterol health that our numbers that there's so many times overlooked. So I'm going to give you some information today that I think it's going to blow your mind, how it can help you, why you should be asking questions, and really it's up to you to take your health into your hands and for you to take control. It's not your doctor's responsibility. It is your responsibility. It's not your insurance company's responsibility, but it's your responsibility to take care of your health. So let's get started. All right, so cholesterol. Sometimes you'll have high cholesterol. If you get your labs done, you will see that most of the time on the side you'll have ranges, and it'll tell you what your normal ranges are, what your expected ranges are. If you're out of ranges, then it's usually because they're way over what the numbers are, and that's an indication for your doctor to most of the time prescribe you some sort of medication. It's usually going to be a statin. So this is what I'm going to challenge you to do. If you go and you see your doctor and your cholesterol numbers are elevated, have them take a look at your thyroid and also have them take a look at some of the other markers, because we have been told that when your cholesterol is high, that you're at risk for having a heart attack. Well, that's not necessarily true. It's not the fat that is putting you at risk for having high cholesterol levels and to put you at risk to have a heart attack. It's not the fat. It's actually the sugar, but that's a whole different conversation. However, if you have a low functioning thyroid, you will more than likely have a elevated cholesterol levels. So let's say that you're going to see your doctor and you do have a thyroid issue, but all they're checking is TSH, T4, and you've heard me in other videos which markers should they be checking, and I'm going to mention that again. But if they're only checking TSH and T4 and you're on level thyroxine, and they're not checking any other numbers and your cholesterol levels are high, then they're mismanaging you. What they need to be checking is all your other markers, your free T3, free T4, like they will check free T4, but usually they don't check free T3. I always go to the extent of checking reverse T3 and antibodies as well. Because if you don't have enough T3, you're going to have elevated cholesterol levels. And if you probably don't know this, but before statins were prescribed, do you know what the treatment was for elevated cholesterol levels? It was thyroid medication, but it just wasn't any thyroid medication. It was a combination of a T4 and a T3. Because not only were patients coming in, they had elevated cholesterol levels, they were tired, they had brain fog, some of them had pain all over their body and they thought they had fibromyalgia. They're like, doc, I just have this pain. And it was just really generalized pain. They were too young to have arthritis, so it wasn't arthritis. A lot of the women, because it's mostly women, were having PMS issues or their cycle was malfunctioning. Depression was another thing, constipation, loss of hair loss. Those are all signs of thyroid issues. So if your cholesterol level is high, and let's say that you are on the thyroid medication and you are on a T4 and a T3, maybe they need to check and elevate the dosage. But not only that, don't just look at cholesterol levels by themselves. You need to look at, as I mentioned, free T3, free T4, TSH, antibodies. You want to look at all your thyroid markers. However, if they want to put you on a cholesterol medication, they need to check other markers and not just look at cholesterol. Yes, look at your thyroid numbers. Yes, look at cholesterol, LDL, HDL. They need to look at also fasting glucose, fasting insulin. They need to look at other inflammatory markers as well as homocysteine, C-reactive protein. Those are other lab markers that they need to be looking at if cholesterol is really the issue. Now, this is what happens. LDL they consider it the bad cholesterol. It's not necessarily the bad cholesterol. LDL is more of a protective mechanism. It will go up because it's trying to go in and repair systems in the body. For instance, if you have GI issues, which I see lots of patients with GI issues, and probably 9 out of 10 of people that walk into my practice or I consult with have some sort of GI issues. If you have some parasites, intestinal permeability, tongue-tied there, bacterial infections, candida, your LDL cholesterol levels will go up as a protective mechanism. So that will happen, but it's not bad if all these other markers, what I mentioned, if hemoglobin A1C is low or within range, triglyceride is within range, your inflammatory markers are in range, then it's not that you need a statin. So they have to start looking at other markers. Now, let's say you do have elevated cholesterol levels and you've had it for some time, and let's say they've already checked the thyroid and they've already checked the gut, but most of the time you're going to find it in one of those two. It's going to be thyroid driven or gut driven. But if you know that there's a family history, one of the best tests that most doctors do not run and they should run is in an NMR. And basically what you're checking is you're checking your particle size and your particle number. So if you're checking cholesterol, you want to know your particle size and number. The smaller the size, the smaller ones are the more deadlier ones. The larger size, the fluffier ones, so to speak, they're like little cotton balls that, like, when they're in the body, they're not really damaging the arteries. It's little BB ones, the little tiny size ones. So that's what you also want to look at. It doesn't cost a whole lot more. Even if you have cholesterol issues, you want to run additional labs, it's not going to cost you more than $100. You know, aren't you worth $100 to really check, hey, should I go on this statin, which has worse side effects from decreased sex drive, brain fog, your mental capacity, cognitive ability? That's the side effects of statins. So you don't want to have to go on that if you don't know what else is going on. So make sure that if you do have that history and you've already checked all those numbers and you want to take it to an extra level, I did it even though I didn't have super high cholesterol levels, but they did go up when I was doing transitioning from like paleo, keto, and changing my diet. However, you need to look at those numbers, particle size, particle number, and then the other test is the best test for cholesterol is going to be oxidized. So that's really telling you oxidized just means rusting. It's been damaged. You want to look at oxidized cholesterol numbers. That's what you want to look at. So I'm going to put some links after this video so that you can see what are some of the tests that I would recommend. Talk to your doctor. Cholesterol levels are usually an indication of lifestyle, whether what you're putting in your body, also with stress, because whether it's an internal stress, you can create damage to especially the gut and arterial walls, and LDL's job is to go in there and patch it up. It's not that it's causing the problem, it's the solution, but what is the problem? LDL will also go up when you're on a high-fat diet, ketogenic diet, carnivore diet, even sometimes paleo diet, and you're eating higher protein, higher fat. LDL will also go up. So if your cholesterol, in closing, if your cholesterol is elevated, you've been struggling with this, you're tired, you're having trouble losing weight, you have that belly fat, you have brain fog, your hands are cold, you've got pain, and like I said, and cholesterol's elevated and it shows up that way, have them check your thyroid. because that's often overlooked. And sometimes you may just have to get on a combination of a T4, T3 thyroid medication that your doctor will prescribe. And as your body gets healthier and you make the lifestyle changes I normally recommend, you'll find that you will start to improve. And it's very, very common with women. Okay, so I hope you had some takeaways with that, and I will we'll see you on the next video. Until next time, see ya. Bye.